Hello everyone and welcome back. My name is Michelle and today we are studying Osteogenesis Imperfecta. This is going to be a crash course, so I would recommend you buckle up and we will dive straight into it. Here is a basic breakdown of the content I'm going to be covering in today's presentation. Osteogenesis imperfecta is also known as brittle bone disease. Its etiology is a type 1 collagen problem. On a clinical presentation, it includes a patient with blue sclera, triangular facies, macrocephaly, hearing loss, defective dentition, also known as dentogenesis imperfecta, barrel chest, scoliosis, limb deformities, fractures, joint laxity, and growth retardation. We can use the silence classification to classify osteogenesis imperfecta into its four types. Type 1, which is of an autosomal dominant inheritance pattern. On a clinical examination, you may find blue sclera. Other associated features of type 1 is that the patient is usually mildly afflicted. There could be multiple fractures and sometimes teeth involvement, but usually type 1 has quite a good prognosis. Type 2 is of an autosomal recessive inheritance pattern. On clinical, you may see blue sclera, associated features. This can be quite lethal, and patients are usually severely affected. Type 3 is of an autosomal recessive inheritance pattern. The sclera are normal clinically, and other features include fractures at birth and a short stature. Type 4 is an autosomal dominant inheritance pattern. The sclera are normal on clinical examination, and other features included being a milder type of osteogenesis imperfecta, sometimes with teeth involvement. The management of osteogenesis imperfecta is supportive, especially for fractures. We would like to incorporate splints, usually for a short period, and mobilize ASAP. Incorporate exercise and surgical correction if indicated. It is important to add biphosphonates as part of the management of osteogenesis imperfecta for a better prognosis. Indications for surgery include multiple fractures, correcting deformities to enable walking or independence, and also if it is the weight-bearing limbs that are affected. Okay, that brings us to the end of today's presentation. Thank you very much for listening. Please leave your comments in the section below. I hope this video helps and good luck for all your examinations. See you next time.